sad that you're leaving and are interested to hear about our new doctor.
Well, yes. Well, after 27 years of practicing, things have a tendency to change in one's lives, and as it is, we have both my wife and I aging and ailing parents, and our daughter is studying abroad as well, so we find it's time to shift our priorities and give some help there, go back home, as we call it. And so the challenge, of course, in thinking ahead of all that was finding somebody to replace or be able to take over the care of all these wonderful patients. And so I was fortunate enough to meet Dr. Campbell at an advanced AK seminar initially, and then also at the AK conference we met again, and we started talking, and I quickly found that this is a person who kind of fit the bill in terms of having the intellectual background, the intelligence, and the intuitiveness mixed and blended, and with his heart in the right place. And I think his own experiences have probably led to that, but it's hard to find somebody who has also studied all the tools and the materials necessary to do this work really well, and have the desire to also really dig deeper for every patient and master a lot of tools to be able to help them fully. So
the last year here has been an amazing experience. I've shadowed many doctors and occasionally run into someone who does chiropractic and acupuncture, or does some lab testing with what they normally do, or they do a little bit of Indian medicine or a little bit of homeopathy, but it's extremely rare to find someone who combines all of these aspects in one place. And I'm very excited to take over Dr. Van Heule's patient base and offer a similar level of care that people have been experiencing, as well as a couple new things like drawing blood work in the office, offering some more physical exams, and just trying to stand on the shoulders of giants and just look a little bit farther for patients to keep offering them a better and better level of healthcare.
it's actually quite exciting for me too to see how Dr. Campbell's going to be able to add a new perspective and add some new tools to the mix to further advance, as things should always expand, and taking the best of what has come before him, and further increasing the level of care and the attention that's being given to people's issues. And so it makes me feel very much at peace and at ease about kind of leaving behind a patient base who've been extremely kind and loving, and for them to know too that they are basically the ambassadors of change. They are the ones going out and having to do, implementing the suggestions and the work that we're suggesting, and in doing so, the changes they're making in the culture, in healthcare, and globally. I feel very much at ease and at peace, knowing, trusting Dr. Campbell and his ability to continue on this work and even expand on it, and continuing to provide excellent quality care to our patients.